Hello everybody, happy Wednesday, good morning. We are going live today with Aimee Baron, I think that's how you pronounce her last name, the founder of I Was Supposed to Have a Baby, and she's the most incredible woman, and I'm so excited to talk to her. And I see you, Aimee. Okay, let me add you. Thank you for joining, Narber, and just gonna wait for Aimee to pop up. Hey, Aimee.
Hi, how are you?
Okay, good morning. Thanks for making the time for this.
It is my pleasure. It is my honor. Happy to do it.
Okay, awesome. So I want to start with like your story, because I feel like as out there as you are, you're still so humble, and I don't think people like grasp like what you do and like how you started this organization. So go for it.
Okay, now like you're making me embarrassed.
That wasn't my intent. I really honestly I've heard about I Was Supposed to Have a Baby, and I never like realized that it was like you behind it. And then when we got to talking, that you're like previously a doctor, and I was just like jaw dropped. And I felt like not enough people know about this organization, and like separating it from, I think like in the Jewish community there's so many organizations for fertility purposes, and you fill such a niche in terms of like the emotional support, which so connects to our company. And I want to make that like super clear to people, so I feel like I want to give you the space to like explain that.
Thank you. Look, this for me is kind of like my second career. It's really my passion project. I am a pediatrician by training. I always dreamed of being a pediatrician. I never would have thought that I would be doing anything else, frankly. I love kids. I loved medicine. I love pediatrics. But what happened to me is sometimes what happens to lots of people is that life didn't go exactly the way I planned it. I thought that I was going to get married. I thought I was going to have a whole bunch of kids. I thought there wasn't going to be any issues. And there was very soon. I mean, we had our first, thankfully, without any issues. Then we had a period of 3+ years of secondary infertility, which included a bunch of fertility treatments. We never got to the point of IVF, but a bunch of fertility treatments, a miscarriage thrown in there. And then thankfully, had our second, and then infertility seemed not to be our problem anymore, thank God. Had our third quickly thereafter, and thought like, okay, we wanted to have 4, 5, 6 kids. And so we were just going, just going. I got pregnant again right away. And in the middle of the second trimester, I went in for an appointment, and there was no heartbeat. This was our fourth baby, not fifth pregnancy, fourth baby. It was just wild, horrible, awful, all the things. There was also no medical explanation. The baby was totally, completely healthy, genetically tested, perfectly healthy. There were no problems with me, and everybody just chalked it up as being a fluke. And then that exact situation happened 3 more times in the span of another 2.5 years.
Oh my God.
Where I would get into the second pregnancy. Again, thank God, getting pregnant, not my problem anymore, but I would get pregnant, make it to the second trimester, and then at some point, the heart would stop beating. Every single one of those babies were completely healthy. Again, like they couldn't find that there was anything wrong with me. We could talk about the deep depression. We could talk about the horrific anxiety. We could talk about all of the things that were awful about that period of my life. The days, weeks, months that I spent in bed, that I didn't go anywhere, that I was a complete recluse. The only time I was functional was frankly when my kids were home. So I would get them ready for school in the morning, and then when they came home from school. But that time of between 8:30 and 3 o'clock, or then right after they went to bed, I was just totally not functional.
I would say that you mean like depression. Was that like depression, anxiety?
So I wasn't I wasn't diagnosed, but I was.
Right, of course. I'm just saying in terms of what you were not functioning with, meaning it was emotional, because it led you to start this organization, which is focused on mental health.
Correct. And the grief. We also need to talk about the grief, because that obviously like that very much is intertwined in this entire story. The intense grief of, number one, you thought you were going to have a family and you thought you were going to have this number of children, and then that doesn't happen. But then also the expectation that once you get pregnant that you're going to have a healthy baby, and then that actual specific grief of a baby dying. Like there's a lot of different pieces of the grief, but you know, those are the two main pieces. Anyway, look, the end of my story is that I was basically broken in every possible way after that fourth loss. I basically, was like, I'm done. Like, I can't do this anymore. It doesn't matter how many kids we thought we might be having. Like, I'm broken. We just put it away. And at some point, like, we both kind of turned to each other. It's funny because my husband remembers it as he turned to me. I remember it as I turned to him. I don't know that it matters anymore, but like we both basically kind of were like, maybe we should try one more time. And like, I'm not even talking about the other pieces of, we did our hijab list, but we also did the Ruchnius piece, and we went and we spoke to all different rabbis, and you went to this different firm and got, and David, and we did like all the different segulos, like every possible
you attacked
thing.
it from every front,
like we tried to just correct. We went and saw every possible doctor in the United States that might be able to give us an answer. And there were no answers. There were a lot of theories, but there were no answers. And we kind of like took all this and said, like, I sort of like threw my hands up and I said, okay, like, we're going to try one more time. We'll do all these things that people may have suggested, including the like totally wacko, crazy, like, stand on your head every second Tuesday. Like, I was like, show me the data. Like, and they're like, we can't show you the data. I'm like, as a medical person, then I'm not interested in doing it. But yet, like, if it wasn't dangerous, we did it. I got pregnant. Getting pregnant, not my problem. We get to the first ultrasound where you can see a heartbeat. There were 2 heartbeats. And I very like cynically said, oh, well, now there'll be 2 babies that die instead of 1, because that was my experience. I didn't, expect anything differently. And, Baruch Hashem, those 2 heartbeats are now children in our lives. And they're healthy and delicious and amazing, and we can't imagine how our life would have been without them. But that experience, look, I mean, I stayed home with them for 2 years. In the midst of this entire experience, I left my job. It was too hard for me to be taking care of other people's babies when I was losing my own. And I left my job. So I stayed with them for 2 years because I really wanted to take care of them and be with them and just like relish that like amazing time that I knew basically I wasn't going to have again, because there were never any guarantees that I could have more or even have them. So it was like, we knew this was the end. And then someone asked me to speak locally in my local shul about my experience with pregnancy loss. And that's when the tide changed. For my entire career. I was right at that point. I had started to interview back again for jobs in pediatrics. The job that I had had previously did not exist anymore. And so I was starting to interview. I spoke in front of 150 women about my story. And then I got this bug. I was like, I need to do this. I need to do this. I need to try to bring awareness to this topic in our community. I need to try to hold space for people. And I felt like I had this unique lens because I had the medical background. I did a lot of psychology work. I was a psychobiology major in college. I helped run a peer support group. So like peer support hotline situation. Like I did a lot of psychological work. And then I had my own story and I was like, I can do something with this. So I actually got in touch with, someone put me in touch with Riva Judas, who runs this organization named Nechama Comfort, which is based in New Jersey, which specifically deals with pregnancy loss. And that was really the bulk of my story. And I worked for her and I worked for them for 3 years. And they're an amazing organization and really do a tremendous amount of good work. But what I saw a couple of things. I saw, number one, that social media was starting. Now we're talking now 4 years ago.
Yeah.
So that social media in the Jewish space had already taken off. Instagram had already taken off. People were using it. That was fine. And I was using it personally, you know, for shopping, for recipes, you know, for all this kind of stuff.
Sure.
But specifically what I saw that people not in the Jewish community, but on the outside, were starting to use social media as a supportive space for people who are dealing with fertility challenges. And it was mind blowing. It was like all of the sudden, like, not that, you know, infertility or stillbirth or any of these issues, you know, you could find them in newspapers, in TV, you know, if you watch movies, like you could find these themes. But the fact that you could actually like open your phone, right? And it was literally in the palm of your hands, and you could talk about anything going on in regard to your fertility in the privacy of your own home, in the privacy of your own little, you know, hand, let's call it, right?
Yeah.
It was mind blowing. This isolation and stigma and all of the pieces that so many of us feel. Yes, there are support groups. Yes, there are blogs. Yes, there are books. Yes, there are people who talk about it. Yes, but there's something very powerful about having that really in this sort of like one-to-one, like almost conversation, so to speak, of you looking at something and feeling like, oh my God, this person gets it. I feel seen. It was very powerful. And nobody was doing it in the Jewish community. That we have so many amazing Jewish fertility organizations who help with the finances, who help with medical guidance, who help with halachic guidance, who do tremendous things, who also, you know, specifically target infertility or specifically target loss, or mostly work with this sect of the community, mostly worked with this segment of the community. I wanted something that everyone would be able to feel connected to. I wanted something that no matter what your diagnosis was specifically, that this pain and this angst of not being able to have the family of your dreams, this is a universal problem that anyone has, regardless of what your diagnosis is. And I wanted to do it on social media because of the power and the anonymity. And so welcome to I Was Supposed to Have a Baby. That's what we are.
Wow. I'm like, I have to like take all this in that you said. I didn't know all the details of your story at all that you just shared. So like for me, a lot of this was like a first time, but like, oh my God, what you've been through. And then you started this organization how many years ago? Just to like,
so
around like 4 years.
It's 3.5 years ago.
3.5 years ago. Wow. Unbelievable. And I guess like so would you say like what differentiates you besides for many things, but I would say like, is it the social media piece? Is it the focus on emotional support? I feel like you do that like above and beyond everything else because you feel like that's what was like the most needed. And that's what you lacked in those years that you were struggling. Like you felt like you were the only one.
Correct. Look, our main mission is to make sure that people feel seen and heard in their struggle. And that is the essence of the emotional support, right? The mental health piece, that's our main mission. Our vehicle is social media. So you can, you know, anyone can, many of the other organizations also provide mental health, but their vehicle looks different. Our vehicle specifically is social media. Yes, we also run support groups. Yes, I also do trainings. Yes, I also am brought out to speak in different communities. But our main vehicle, the way we give people that emotional support is via different platforms on social media.
Got it. Yeah. You guys are killing it on TikTok. I see you there. Now that I started.
We're not killing, but we're trying. We're
You're
trying.
doing a good job. Wow. Okay. So I totally get that. And like the focus is on the mental health support. So so you guys have support groups that help that people can just like, it's not medical based. It's really just emotional support groups and it's in person, online, both.
Correct. So we have peer-to-peer support groups specifically. They're not, they are meant to be specifically in that design so that people feel less alone. It's supposed to be that you're getting support from the other people who are there. And they're specifically topically based in terms of what you're going through,
Yeah.
but it's all about emotional support. It's not which doctor did you use or what happened after your miscarriage and how long did you bleed for. Like, yes, if you bled longer or you didn't bleed as long, that might, you know, lend is the wrong word. That might contribute to your own emotional health because bleeding longer, 100%. But the entire focus of all of these groups are all about the emotional support solely.
Wow. Amazing.
Yeah. And we have 5, is it 5 or 6? We have 5 or 6, I'm forgetting at this point, but 5 or 6 groups at this point that we run on a monthly basis, and they're run via Zoom.
Wow. Amazing. So anyone can join, and I love the fact that it's like peer-to-peer.
Free. They're free. We don't ever charge. They're open to anyone and everyone.
And is it men and women? Because recently we got a question about a spouse that's struggling with his wife that just miscarried. So I'm curious about that piece. Like, how do you address that?
Yeah. I mean, the answer is that they're open to anyone, but in all of the groups that I've run and been a part of, and I was first have a baby, and frankly, even in the groups that I was in and part of and ran at Nechama Comfort, I can count on less than one hand the number of men that showed up.
I feel like there's a need though. Like if you wanted to start like an old men's.
There is. So it's so interesting that you're asking that and saying that, because there is absolutely definitively a need. And we've had discussions with a couple of male therapists about bringing them on board and having them run these groups. The problem is that men don't show up. Like, and like there are other groups that offer them, and sometimes you know there are a lot of factors, but we're speaking broadly. That the ones
stereotyping, but I hear
it. The reality is that again, like if we're using these stereotypes, that often peer-to-peer support is not the way that men get the help that they need. There are other outlets for them that are more effective for them. Again, we're using vast and horrible stereotypes right now. Horrible stereotypes.
At least we're calling it what it is, but I hear you. Yeah.
Right. And so look, as a person who runs an organization, financially, does it make sense for me to pay a therapist to run a group where there's not going to be anyone who shows up, or there's one person who shows up?
Yeah, no.
It's that's not the best usage of the funds that, you know,
correct.
that we
Correct.
try.
And it makes sense because, like you said, it makes sense because I think men do get their needs met in different ways, like in a general sense. And also they're not the ones, like, you know, a woman that's going through this, her body, her mind and her body is impacted. So like her whole life changed. The man is only dealing with like the emotional, like it's solely like an emotional piece versus like being a physical piece too.
But I want to just because I feel like we're bashing men a little bit, and obviously we don't mean to be, like, we're not bashing,
totally not,
totally not. But I want to say there are many, and I mean many men that I've worked with personally, or that I've, like, through their wives had discussions with, many couples where the man is not okay. The man is really not okay, both from an infertility perspective or from a loss perspective. The diagnosis doesn't matter. That the women may be fine, or the women may also be struggling, but the men really are not okay. I think the point that you and I are bringing out here is not that men don't need support, because they absolutely do. Absolutely do. I think the group support is just not where they feel comfortable. I think it's more individual support. They often lean on their friends in different ways, or in the, like, just being out with their friends to take their minds off of things is often very helpful for them. The distraction, as opposed to like intensive personal work, like they, on a stereotypical basis, they need the support just as much. It just looks different for them.
The model of how to get it. I love that you differentiated that. Yeah, I totally, because I want to, you know, if men are listening over to this live, I want to encourage them to get the support, but get it in the way that you need it. You know? And it might not be that, like, group format, that support group format. Okay, amazing. So I want to pivot now just to, like, actually helping these people that might be listening to this over or joining now. Like, infertility is like such a broad term, right? Because it can be so many different things. Like you said, primary, secondary, someone's dealing with adoption, someone's dealing with loss. Like, it can be so many different things. What would you say is like the 3 to 5, or any number you want to put on it, like common struggles that you've seen patterns repeat that people are struggling with? It could be feeling based, or it can be like, and it could be more like practical, like, you know, the most common issue that you get confronted with is secondary infertility. You know what I'm saying? I'm just putting it out there.
Yeah, I mean, so I'll just deal practically and then I'll deal secondarily. So
Mm-hmm.
practically, people look, the most common fertility struggle that people deal with is a loss. So is miscarriage specifically
Mm-hmm.
because of just the numbers. The numbers are that 1 in every 4 pregnancies will end in a loss. And
Mm-hmm.
if you're in the from community, that means this is happening to you or it's happening to someone that you know and you love dearly.
Yeah.
Because we just have larger families. That's
Mm-hmm.
just practically the way it is.
Mm-hmm.
So if you're having larger families, if you're aiming for a larger number of kids,
Mm-hmm.
that means statistically speaking, this is going to happen to you. So
Mm-hmm.
that's in terms of the overarching, topics that we deal
Yeah.
with. So miscarriage or loss in general is definitely number one.
Yeah.
But I don't want to put aside infertility because infertility, it's not as large of a number, but the numbers are that in the frum community, it's about 1 in 6 couples
Mm-hmm.
deal with infertility, some form of infertility.
Mm-hmm.
And about like 40% of the time, it's because something's going on with the woman. About 40% of the time, it's something that's going on with the man. And about 10% of the time, it's both or unexplained or just sort
Mm-hmm.
of in that amorphous state. And the piece that I just want to bring out again, because now we're like, again, talking about men, I think there is this perception out there in the community that when a couple is dealing with infertility, that it's definitely the woman's problem. Like that's,
Mm-hmm.
and I don't, that's not a frum problem. That's a general
Mm-hmm.
misconception that is out there. It's the
Mm-hmm.
woman's problem. There's a problem with her eggs, that she doesn't have as much, she doesn't have good quality, whatever.
Mm-hmm.
And people, for whatever reason, don't even think about sperm number, sperm quality,
Mm-hmm.
but the equal amount of problems that we see based on just like looking at the data,
Yeah.
it's equally a man issue and a woman issue. So I
Mm-hmm.
think that's just the first
Yeah.
piece. And so sometimes like the misconceptions that we deal with are that the women who are hiding the fact that their men have an issue because the men don't want to speak about it publicly, and people just come to them and say, oh, like you must be like it must be so hard for you that you're dealing with blah blah blah,
Mm-hmm.
because they make the assumption that something is going on with the woman.
Mm-hmm.
So though those are, I think, just in general,
Yeah.
loss and infertility at large.
Mm-hmm.
And I'm like just bringing out one tiny piece right now,
Mm-hmm.
but infertility are the two main, the biggest topics that we deal
Mm-hmm.
with.
Mm-hmm. And I love
Emotionally,
that data. I like that data that you
yeah,
shared. Like, I think it's also can be very validating. Even like speaking to the woman that's trying to like cover up for the husband, like giving them a space to realize like, you
absolutely,
have to do that, but also like it's not your fault. It's not, it
absolutely,
could be anyone's fault, but
absolutely,
it's just a matter of like breaking down the data and the numbers. Yeah.
absolutely. And then, the other piece from an emotional standpoint, the
Mm-hmm.
two biggest pieces that we deal with, number one is the sense of isolation, shame,
Mm-hmm.
pain, suffering that the person or the couple themselves are going through.
Mm-hmm.
And then the other piece is what everyone else, the misconceptions and the comments and the pieces that are coming from the outside from
Mm-hmm.
everybody else about judgment, about just saying mean things or not even mean, I'm going to say insensitive and
Tactless.
but tactless, and
Yeah.
also like not from, and I really want to be very careful here.
Mm-hmm.
The comments and the insensitivity that are coming are usually not from a place that are intending to cause harm. They're
Mm-hmm.
coming from a place of being uninformed or uninformed or uneducated about
Mm-hmm.
what a struggle like this can look like.
Mm-hmm.
And therefore people just say things that they don't realize are inadvertently hurting people.
Right.
So I think like what we try to do, and I was supposed to have a baby, is we try to do like, we hold space for both of these kinds of things, in that every part of our content is always about like acknowledging the pain, acknowledging the suffering, talking about the isolation, just
Mm-hmm.
enveloping people in the warmest hugs that we possibly can try to give them while they're going through this. But
Mm-hmm.
also in turn, trying to educate, trying to sensitize, trying in that education and sensitization, my words today,
That's a hard
like
one.
talking about it also to validate what people are saying when they're complaining that they're not getting the support they need, right? So we try to do the educational piece as well, because we know that even though that this is an individual problem or this is a couple problem, at the end of the day, this is a communal problem.
Sure.
And it's our job as being part of the community to learn how to be kind and how to be sensitive to all kinds of struggles that people are dealing with, and to know that everyone doesn't have this picture perfect life. And we need to try to hold people in their pain, even if we have no idea what they're going through. And so that's the emotional, those are the two biggest pain points that we deal with.
So like the validating, right? I love that you divided it with like the validating and also educating. Like you're also educating people, like this is not the smartest thing to say.
Correct.
And I think that's like so needed. And yeah. Okay, I love that you broke that down like from a data, the practical perspective and the emotional perspective. What would you say like recommendations for people, I guess from an emotional standpoint, because like the doctor stuff can be so specific and nuanced, but from an emotional perspective, like what were the things that helped you? Of course, community is huge, which is why you created I Was Supposed to Have a Baby, and people can reach out and join the support groups. And that can be one of the big things we talk about. But I want to hear also like things that have helped you. Was it therapy? Was it having a mentor? Was it having one best friend? Or what can people do to like help themselves get through this dark time?
The answer is yes, 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 and yes, like to all of those things. For me, because I'm going to date myself here. So all of my struggles happened between 10 and 13 years ago. The world looks very different in terms of public discussion at large and public discussion within the frum community about all kinds of mental health challenges. And I'm putting, fertility challenges in that box right now, because we're talking, this is effectively a mental health challenge as well. And so the world has changed, but for me, there was nothing like this that existed. There weren't support groups. There weren't like that, or at least I didn't find them. Let me just say that. It's not to say, because
it's always scary to say like there wasn't,
and I was going to say, now that I'm saying that, I know that that's not true, because a time I know had certain support groups. Then I wasn't a support group person. I wasn't interested in that. I needed to know that I wasn't alone, and that there was someone else out there, but support groups wasn't doing that for me. During my losses, there was a friend of a friend who had gone through 3 second trimester losses, and she was going through those losses around the same time that I was going through mine. And I mean, we always say, and I'm still very close with her, she was the reason why I stayed sane, because she was the one who I could just let it all out with and be hysterical, and I didn't have to explain myself, and I didn't, she knew exactly everything that I was feeling. That was, for me, the most powerful thing and the most powerful piece of support. Therapy for me was not helpful. I probably could have found better therapists, someone I might have clicked with better. I didn't need someone to give me techniques on how to manage my grief.
Right.
I needed someone who actually practically got it and could let me cry and could tell me that, who couldn't tell me that it was going to get better, but she's like, I'm never leaving you, and I'm going to help you, and we're going to get through this. And I needed that kind of practical support.
Yeah.
But what I will say is that during my pregnancy with my twins, I had tremendous crippling anxiety, crippling panic attack anxiety. Pregnancy after loss is a very real phenomenon in terms of the anxiety that these women go through, and even men, and thinking about maybe the baby is going to die. And the anxiety can be absolutely overwhelming. And so for that, I saw a psychiatrist who did a combination of therapy, which I found totally unhelpful. Again, she was like, breathing techniques and medication. I'm like, can you tell me my baby won't die? And she's like, no. I'm like, oh, this is not helpful. Like it wasn't helpful for me.
Yeah.
But what she did give me is I did get a short acting anti-anxiety medicine that was safe to use. Again, we're talking 10 years ago. So that was safe to use in the second trimester, which is when all of my losses happened. So like my anxiety it was kind of like riding this line. It was like, okay, I'm nervous. And then I got to the second trimester and it basically like went through the roof. And that was when I was having panic attacks. So
makes sense.
So she was able, along with in consultation with my maternal fetal medicine doctor, my high risk OB. So I was able to get a short acting medicine that was safe for me to use, and I used it.
Yeah.
I know there are lots of medications now, and there's a specific field of fertility psychiatry. There are lots of things that people can do in terms of mental health and pregnancy, which was not available or tested at that point.
Wow.
But I highly, highly, highly encourage people to reach out and to not suffer, even if you're pregnant and you're experiencing any kind of mental health challenge, because there are medications out there that help, and there's no reason for people to suffer.
Correct. I love that you said that, and I love the honesty about like therapy not being helpful. And I think that may have also changed over the years, because I know that there are now therapists that like specialize in this. You know, like
100%.
And they get that all you really need is a shoulder to cry on, and someone to hold the space for you and to like help you through the grief and the fear and the whatever it is, right? And I feel like, you know, that like if you didn't have that friend of a friend who's going through the same thing, who could really get you, like a therapist can be that type of support as well. But I also like the, you know, disclosure about the medication, because I think that's also like something that's for some people so taboo, and really today there are so many options. Like I've heard about that from other people as well.
So many options. And I just want to say, like, in regard to therapy, just to your point, that the world has changed today. I maintain a list. You and I have spoken about
exactly.
This. I maintain a list of people who specifically specialize in fertility therapy, that for people who are going through infertility, for people who have had loss, there are people who are trained specifically in this area. It is not the same as it was when I was going through it. And there are wonderful people out there who really get it. At the end of the day, though, it has to be the right match. Like one person who's really wonderful may be horrible for you and may be great for your friends, and vice versa. So like we all know that, but there are people who are trained, and they're beautifully trained in this area now.
I love that you said that. And I think that like, like it wasn't like, I don't know that it was like that 10 years ago. Like it was just like a therapist is a therapist, and like they did whatever they could. And like, I can totally see how, you know, giving like CBT skills for somebody that's going through tremendous grief, loss, anxiety through the roof. I mean, for some anxiety, yes, CBT can be helpful, but it needs to be coupled with like a very sensitive approach with somebody that's in such a volatile space. So definitely like you need somebody. And I think that's like a good point to underscore here, like for even if it's a husband going through this infertility struggle with his wife, like, so, you know, to speak to a therapist that also, even if it's a male therapist or a female therapist that specializes in this space, so that they can actually understand what you're going through on a deeper level. And of course, for the woman as well, to like someone that specializes in this space would be, you know, paramount to other like, you know, credentialing, so to speak.
Absolutely.
Okay. We're almost towards our end, but I want to talk about a bit, how can other people be supportive to someone that's going through this struggle? So like we can combine that with things to say, things not to say, but even just in general, like what was supportive, what wasn't supportive. And we could even include here like the spouse. So whether it's like, you know, to the actual woman that's going through this, the husband that's going through this, etc.
Yeah. The main thing that people really should take away from any kind of fertility struggle, or really anyone who's going through any kind of pain, you can't fix it. You can't. There is nothing that you can do that will fix this problem. You may know a great doctor, a great therapist, a great this, a great that. You may know all of these things as an outside person. Yeah. But I promise you that when someone is dealing with a tremendous challenge, they're also doing their own research, and they're finding their people out there. So I think the main piece that is important for people on the outside to understand is they don't need you to be their fixers. They need you to be their friends. to be their loved ones, to be their supporters. They just need you to be there for them. Like, it sounds trite. It sounds like, you know, like, well, of course I'm there for them. And of course I'm this. And I like, yes, but it's actually quite hard to do, because when someone is in deep pain, like, just to let them talk, just to listen, just to give hugs, just to say, I love you. I'm here for you no matter what. We're going to get through this together. I'm going to hold you as you get through this. Just to do those things. It's like, it feels like it's not enough.
Right.
It feels like how could it really be enough? It's just, I'm just listening. I'm just, right? And yet the problem is I have a doctor for you. Oh, I just read this study that's going to be great. You should go on vacation. You should relax more. Everything happens for a reason. Don't stress about that. It'll take time. Hashem only gives things to people who can handle it. You know, on and on and on and on and on. Like, these are all things that people say because they don't know how to just hold space.
Right.
And
just
be
holding space is really hard. Like, it's really hard to even think about. Like, if I know someone's struggling, like, it's so hard for me to just like send that loving text and not do anything more and not be like, you know, it's so hard. It's so hard to just.
We feel like, how could that possibly be enough? Like, I need to also like, okay, chocolate is great. Okay, ice cream is great. Okay, fuzzy socks and, you know, warm blankets and scented candles and like all those things are good, right? And I'm not saying don't send them.
Right.
What I'm saying is the more important thing for people is actually you. And they need you more than they need your things. So send the babka and like send them and do that, but don't let that be in place of the thing that they actually need.
Right.
And try to not accompany it with the like all these other like trite things that people say. And the one last thing I'll say about this is that nobody is perfect in the way that they react and respond to people. I myself, I was talking to somebody last week and I responded immediately with like someone who like just went through a horrible tragedy in their lives. It has nothing to do with fertility. I was like in a rush and I like immediately like texted back something, and like an hour later I looked back at my text and I was like, oh my God, like I just did exactly what I tell everybody not to do. Like me, like I educate people and like I literally did exactly all of the wrong things. So I just want to say to everybody out there, you are human.
You're human.
You are human. The most important thing is to own up to it. Apologize and then do better the next time. Right? Exactly. Like if you just like don't make mention of it and you don't own up to it, then the person is going to be upset and they'll be mad at you for giving that response. But they're never upset for apologies. Like you can say like, I totally screwed up. I did that wrong. I shouldn't have said that. I apologize. I'm sure I made you upset. I'm so sorry. I totally get if you don't even want to talk to me right now, or if it takes you a few days or a few weeks because you're so mad at what I did. But I recognize that I did it wrong and I'm really sorry.
Wow. I love that. I love that you shared that. And that's so true. Like sometimes I can't remember an exact moment when I've done such a thing, but like I definitely have. And it's like you feel so like yucky.
Sick. I feel sick. I felt sick. I really felt sick about the whole thing. Like honestly. Yeah.
Exactly. And sometimes I feel like you can even apologize to the person and they won't even know. Like they're not as sensitive as you. You're so skilled in this that they are like, okay, it wasn't the text that made me feel the best, but it wasn't like I wasn't offended. But like that apology can mean so much more then, because it's like, well, they meant so much more, you know? And just that point of like not fixing. So I think that's like a brilliant thing to share. And I'm so happy you shared it, just to be able to hold space. Like that's primary. I do think though that there are times, I'm thinking just in personal life and with people that I've been in touch with, like sometimes there are different people in your life that would appreciate you saying, this must be, hell for you. You have so much to research now. Give me what I can do for you. So like, don't assume, like, for the, whoever's listening to this, like if you're that, person's significant other or somewhat related, like a really close person that has the capabilities and the capacity to do some actual legwork, some actual, helping them, it's not that for you, it might not just be enough to hold space. If you have the ability to do more, you might, and that's where I would like encourage people to like actually ask the person, what can I do? And even offer, I can do this. Can I do this or this or this? But it's so different than just being like, oh, did you hear about that doctor? Like, after like, not speaking to that person for 2 weeks.
Definitely.
It's a very different space that you're in. So
definitely, I love that. And also I want to just tease out another point to leave people with. The practical nature of what you just spoke about. The like, can I help you with, do you need help researching? Like it can also apply to, do you need help getting groceries? Do you need help to run this thing to the dry cleaner? Do you need help, like maybe they have other kids, like do you need help, do you want play dates for your other kids? Like actually offering these practical pieces as opposed to, I'm here if you ever need anything.
Correct.
Like that's nothing.
Correct.
I'm at the store now, and
what can I get you?
Like I'm at Costco right now. What do you need?
Right.
Like
exactly.
Those practical kinds of help like are always appreciated. The person may say no, like I'm good, like really not interested in bulk amount of cheese right now, right? Like, but but those practical pieces are really valuable.
Totally. So I love, I'm so happy you underscored that. I'm like, you can be smart about this. I think that's like the whole point here. Like, just be smart and think like, what would I want? It's so hard to put yourself in that person's situation. It's even like, could be fear-based of like, oh my God, I can't imagine what they're going through. I can't even think. But like, to really think like, maybe if they just had got terrible news, then you're in Costco, then probably don't text them that you're in Costco. Maybe text the husband or the sister or the brother and be like, what can I get them from Costco? So like, just be smart about what you offer. And I love that you like, the empty words of like, I'm here for you. Let me know if you need anything. When a person is in such a weak state, they're going to be the last person to reach out to somebody that texted them that. So it's much better to say, I'm holding space for you. I'm here. I'm thinking of you. Can I do this? Or, I'll check in again in a week, or, things like that. So I think that just being smart about that, or, and again, knowing that it's normal and okay to mess up because we're human. Like, I think that's like, so the fact that if you messed up, everybody listening, if Aimee messed up,
I was going to say, and I messed up in a big way, and the person agreed with me that I messed up in a big way. They knew exactly how I messed up. And it was like, and so that's what I'm saying. Like, even experts, we all mess up. All of us are human. We're all human. This is not easy. This is not easy.
Correct. Like, being there for someone, like, we think that, like the other person's going through their trauma, and like, we're now in like, it's almost like that, like guilt and that, survivor's guilt syndrome or something like that. But it's like the person that's supposed to be there for that loved one is also like in a really tough spot, and it's really not easy for that person either. Anything you want to wrap up with, or
no?
Any final?
I really just want to thank you for this opportunity.
Thank you.
I am here. Mental health is the crux of the work that we do. We support, this piece is deeply important to us. We refer people out to therapists all the time and psychiatrists, because as much as we are holding space, we know that many people need much more than what we're offering. And we know that when people are emotionally healthy, that it permeates their entire lives and can help them through their fertility experience, because fertility challenges and mental health challenges really go hand in hand. It's hard to hear devastating news over and over again when you're not pregnant or when you've lost a baby. It's hard to have treatments fail. It's hard for them not to give you a diagnosis if your baby died and they don't know what. Like, these things are hard. Depression after a loss, or when you're going through infertility, those are things that happen more commonly than not. And they are hard. So I think like just normalizing this sort of maternal mental health space is extremely important. And there's help out there, and people need to know that.
Correct. Yeah. You're doing amazing, Aimee. Thank you so much. Thank you so much for sharing your story and like everything that you do in the organization, of course, but also like everything that you shared today. I think this was so super, super helpful. And I really appreciate it.
Thank you. Thank you for the opportunity, and continue
All right.
doing your good work,
Thank you
connecting
so
people
much.
with the people they need.
Awesome. Thank you, Aimee. We'll be in touch. Thanks
Sounds
everyone
good.
for tuning in.
Bye,
Bye-bye.
everybody.